I found this ad in a magazine about crowd health, which is health sharing, and it kind of sounded like a scam to me. I thought, what is health sharing and why are people doing it? What it is basically people pledge to pay for one another's medical expenses. So just say you have to get your gallbladder removed. You'll tell the company, and then they'll send out a request to all their members asking to help pay for it. And I talked to a lot of people who are on it, and surprisingly, I didn't find very many people who are unhappy with it. A lot of people are really happy with it, especially because they were just so sick of dealing with their health insurance companies. And they were just paying a ton of money for health insurance and getting claims denied and just feeling like health insurance was a scam. I think a lot of people find this appealing because the money goes directly from one human being to another human being to help them pay for healthcare needs. It's not going to some big insurance company and being invested somewhere and then going back to CEOs for profit. It really is a fairly straightforward way of a lot of people pooling their money together to using it to pay for healthcare. It's kind of, what the original idea of insurance was, that a lot of people put their money in to make sure if something bad happens to them, they'll be all set on the other end. I think insurance has just gotten so complicated and so difficult to use over the years that this is almost stripping it all back and looking for a different way to handle healthcare claims. There are definitely some big negatives. One, they're not required to cover anything. So unlike traditional insurance, where if they deny your coverage, you could go to your health commissioner or you can appeal or do a lot of different things. They can basically do whatever they want. They're not regulated. Two, they don't cover a lot of pre-existing conditions for a while. So if you got pregnant and then signed up, they would not cover your pregnancy for about 9 months, which at which point it's probably too late. And one other thing that's a negative about it is that you have to do a lot of legwork. So you have to call your doctor's office and say, I'm paying cash. What's the cash price? A lot of places might not want to give you the cash price, might not have the cash price. You have to pay up front, which is probably not passable for a lot of people. And then you have to submit your receipts to Crowd Health to wait for them to pay you back. So it's not that different from an insurance company, but you have to do a lot of the work that the insurance company would be doing otherwise. I don't see some widespread abandoning of health insurance for health sharing. I think it's too risky for a lot of people. And the idea that you could be stuck with bills that they won't pay is really scary. But I do think it's interesting that so many people are so fed up with health insurance that they're willing to take that risk. And I think we are going to see more alternatives emerging of people saying there's got to be another way to do this and testing things out. It's a way of looking at something that's different from what we have now and seeking an alternative. And people seem to be into it.